Good morning. Welcome back to the Broadcast Retirement Network. This is BRN AM for Wednesday, July 31st, 2024. And our top story today, ways to prevent heart disease. Joining me now to discuss this and a lot more, Dr. Mary Branch is a cardiologist with Cone Health. Dr. Branch, it's so great to see you. Thanks so much for joining us on the program this morning.
I'm happy to be here. Thanks for inviting me.
Yeah, and we're going to talk about heart health and hypertension and all points in between. I want to start with some basic question, which is heart disease. How do you define heart disease?
Yeah, heart disease is a spectrum. So I think it's challenging when folks think about their heart health and heart disease in general, because there's many different facets to it. So your heart is kind of like a house. So there's plumbing, there's electricity, there's pipes. So things might be going wrong with the pipes, which is your arteries that bring blood flow to the heart muscle. So they can have blockages sometimes that have to be fixed with a stent or surgery or medications. You can also have electrical problems. So electricity helps the heart beat and function. And so if there's a disruption in the electrical circuit, then that can cause problems as well. That's considered heart disease. Or if you have a fast heart rhythm that's abnormal, like atrial fibrillation, that's an electrical problem. And then pumping, your heart's a pump. So if there's something that goes wrong with the pump, if it gets weaker, that's more in line with heart failure. And so that's that sort of facet of heart disease. So it's a broad spectrum of problems, and there's still more than that. You can have cancers in the heart. You can have many different issues with your heart, but those are kind of the broad categories.
And what I know, just as a regular person, even without seeing my practitioner, my primary care or another physician, would I know if I have heart disease or have a problem? I would imagine like shortness of breath might be a symptom, but are there things that we should be thinking about as we're kind of walking the streets and going about a course of our lives?
Yeah, so it can be tricky because these symptoms can be a sign of heart disease, like you mentioned, shortness of breath, but it could also just be deconditioning from not exercising as much. It could be COPD. So it's hard to, because when you Google a symptom and everything comes down the list, it's hard as just being a human being to know how to differentiate those things. So that's why it's helpful to have a partnership with a primary care physician to kind of work through what might be going on. So thinking about yourself, you want to think about, well, what is my risk for heart disease? So if you're thinking about blockages, if you've had family members who under the age of 60 have had multiple heart attacks, then that might be one indication that there may be a genetic risk. If you have risk factors like diabetes, smoking, those are also signs that you may be at higher risk for heart disease. So if you're having the shortness of breath, it may be more likely that's related to heart disease if you have those risk factors. So it kind of depends on what we say sort of someone's pretest probability. What's the likelihood that you actually have an issue? And also age. If you're older, it's more likely that it can be related to heart disease as opposed to if you're, say, in your 30s.
And when it comes to heart disease, and again, I'm going to lump it all together because I'm a layperson. I don't have your expertise. Where does that fit in the diseases in our country? I mean, is it at the top? Is it in the middle relative to other diseases such as cancer, diabetes?
Right.
And how is it trending? Is it trending up or down?
Yeah, so cardiovascular disease overall is the number one killer, and cancer is, certainly a close second. So it's extraordinarily prevalent, and as I mentioned, a lot of that risk just comes with aging. And so unfortunately, that's not something that we can necessarily prevent. We're all going to age. Our vessels are going to get more plaque. They're going to get hardened, and we're going to be at risk for heart attack and stroke, just as a process of aging. But so when folks say, oh, my grandparent had a heart attack, so it runs through my family, well, it's just common in general. So that's not necessarily a genetic predisposition. But if somebody was younger, under the age of 50, then there may be some genetic factors there. So
yeah. And last question before we go to a commercial break, how much does food and what we consume play a role in heart disease? And I'm thinking, if I go to Chick-fil-A, they're not a sponsor, by the way, but if I went to Chick-fil-A and had a grilled chicken breast sandwich versus if I went to had some fried food every once in a while, how much does that play a role in some of the challenges that we're talking about this morning?
Yeah, so food is really, I would think of it as a medicine. So the American Heart Association is really trying to push the initiative of food as medicine. So food is extraordinarily important in terms of what you put in your body. So if you're eating a lot of high cholesterol, that can increase your cholesterol burden, your burden of plaque, and your risk of heart disease and heart attack and stroke. If you're eating a lot of calories that are unhealthy, then you're going to have risk of obesity. Obesity has a lot of associations with sleep apnea, atrial fibrillation, heart failure. So what you're putting in your body is extraordinarily important in terms of how you can try to reduce your risk of cardiovascular disease. So, keeping your weight down and really being cognizant and intentional about what you are putting in your body is important in terms of being able to try to prevent heart disease. So, medications are helpful, but they only have kind of a marginal benefit. What really helps the most is really your diet and your physical activity. That's where you're going to get the biggest bang for your buck, is what you're consuming and your activity during the week.
Yeah, really good information. Dr. Branch, I need to take a very quick break. When we come back, we'll talk more about prevention and treatment. You're going to want to stay tuned right here, BRN AM. Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device. Welcome back. We're joined this morning by Dr. Mary Branch, a cardiologist with Cone Health. Dr. Branch, thanks so much for staying with us this morning.
I'm happy to be here. Hopefully we can help some folks today.
Absolutely. Hey, knowledge is power. I think that was part of Schoolhouse Rocks when I was a kid. I'm really dating myself.
Yeah.
Let's talk about prevention. And you talked a little about this at the beginning. Visiting that primary care physician at any age. How important is that to detecting early onset of heart disease?
Yeah. So it's extremely important. One, because it's about establishing a relationship with a physician early so they can get to know you. What are your typical symptoms? How, do you respond to different things? So it helps to have somebody who knows you at baseline so that if something changes, they'll know, oh, so-and-so usually doesn't complain about X, Y, and Z, but now they're saying a shorter breath. So it really helps to establish that relationship and have that advocate physician who knows you when there's an issue. Someone who, say you go to an emergency room, they can reach out to that primary care and try to get a better sense of how to better help you, because everyone's different and everybody's going to present differently. So, and in terms of age, I typically recommend folks at least by 40 establishing with a primary care doctor, not just for your cardiovascular health, but your overall health in terms of, as women, we start to need mammograms and, colonoscopies are starting earlier. So we're seeing a lot of comorbidities just in general in younger folks. So it's really important to start early so that by the time you're 50 and 60, you're not dealing with cancer that could have been prevented or, a heart attack that could have been prevented. So it's really important to start early. Lab tests that can be done initially are looking at your lipid profile, so your cholesterol. Is your LDL very high? Do you have a genetic predisposition to high cholesterol, and can that be targeted and treated so that that can prevent your risk of cardiovascular disease? So again, it's just good to just kind of establish a baseline with someone so that if anything changes, they'll know, okay, this is how this person's labs were at baseline. This is what their EKG was at baseline. So we'll know if anything changes, what to do.
And you mentioned, insurance. A lot of people have insurance. Either they get it through their employer, or they get it through one of the exchanges, or they just go out and buy it. The insurance typically covers what we're discussing this morning, does it not? Like going to the primary care physician, getting basic blood workup. So it's not like it's that big of an out-of-pocket expense or a huge expense. It's really just a function of you just got to do it. But it just seems like I would do it. I've done it, and I visited the primary care physician since I was like 18. It just seems like that because it's covered. Why not do it?
Yeah, I think that's a great point. So if you think about it, let's say there is some, small amount of out-of-pocket expense. That is allowing you to save a lot of money on the back end if you did develop a stroke. Think about the cost of being in the hospital. If you had to take an ambulance, that's very costly. Rehab, all of those things cost a lot of money. So if you're going to, the clinic, let's say the copay is $10, or there's something that you're thinking, I don't think it's worth it. Just think about you're saving a lot of money on the back end, because as you get older, this may be the only thing you do pay, as opposed to an extended hospital stay or more medications or an intervention like a heart catheterization or surgery. So I would just think about it as actually saving yourself some money if you're on the preventative side.
Yeah, and proactivity is certainly better than reactivity, at least when it comes to disease and diseases like heart disease. Dr. Branch, let's talk a little bit about treatment in the closing minutes of our time together. Let's just say I'm diagnosed with heart disease. I have a high LDL, blood work, and I'm showing signs. What has been developed? What has been the evolution of treatment? Science is amazing, especially in the last decade. So there's probably a lot we can do to recede some of this disease.
Yeah. So the medical management, has been there's been a lot of great strides in terms of cholesterol lowering medications. Now you have injectables that are a lot more effective in dropping your cholesterol and reducing your risk for cardiovascular disease. So, or if you have heart failure, there's a lot of new medications now that really help improve the heart pumping function, like Entresto, for example. That really makes a difference in patients, and I've really, anecdotally and through the data, have seen the improvements that these medications can make. So, so from that perspective, they've done very well, to the point where you haven't needed as many interventions as you may have needed in the past when folks are on medication. So if someone comes in, they have these risk factors, or they have documented coronary artery disease, say from a CT scan, a lot of folks may get a CAC score if they're concerned and they have a high family history of coronary artery disease. So if your CAC score is high, the first question is, are you having symptoms? Are you having chest pain? Are you having shortness of breath? Is this something that's progressive? If there's something that's progressive and there's a concern, then there's an indication to maybe go in and take a look with the heart catheterization. But if you're not having any symptoms at all, you actually can just manage it with medications. So what we typically do on a preventative side is hit certain targets. Target number one is your cholesterol and that LDL. If you have a lot of plaque, you want that LDL to be less than 70. Another target we try to hit is weight. So having a healthy BMI can certainly help prevent your risk of heart disease and disrupting plaque to cause a heart attack. Next is lifestyle. So if you're smoking, got to quit smoking. That's the worst thing that you can do, for your health. And if you have diabetes, a lot of these medications like SGLT2 inhibitors can be very helpful, again, in preventing cardiovascular disease risk. So those are certain targets that we aim to treat. And then aspirin as well, if you have, again, a really high sort of coronary artery calcification. So we start with medications, we aim to hit those targets. And then if you're developing symptoms, then that's an indication to go in and try to fix it. But otherwise, again, it's lifestyle and prevention management.
I mean, the way you lay it out, it just seems so easy. And the earlier you start, it's like, I almost liken it to compounding interest. You start early saving, you're going to have a lot more if you start early, because of the power of compounding. If you start early with your visits, getting things, getting basic information, you're going to be a lot better off long term.
Absolutely. Yeah, so I say, the best way to treat a disease is actually to prevent it. Yeah. So if you don't have it to begin with, then, you don't need to worry about how do I treat this disease now on the back end. Once again, there's some things you can't help. So, after the age of 80, your risk of atrial fibrillation goes up, or coronary artery disease after the, age of 70 or so goes up. There's some things that we can't mitigate. Aging is one of those things. And I think nowadays it's been hard with a newer baby boomer population. They want to, it's hard to kind of conceptualize that the body is just aging, and unfortunately we can't always change that. But certainly starting young and being as healthy as you can to give yourself, the best benefit in terms of if things do go wrong, that can be helpful as well. So it's always a good idea to try to prevent.
Yeah, absolutely. Well, Dr. Branch, so great to meet you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Absolutely. I hope this is helpful.
That wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to? Drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Well, then visit our website. Hey, we're back again tomorrow for another edition of BRNAM. We'll have a very special guest and another important topic. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.